The U.S. healthcare system is complicated. There are many different places where services are provided. In doctor's offices, clinics, standalone emergency rooms, hospitals, drugstores, and even in community centers. There are even more ways that healthcare is funded, through private insurance, employer-sponsored plans, public insurance like Medicare and Medicaid, and government insurance for the military and veterans, and even paying for services out of pocket. Let's examine how money flows through the healthcare system and how it works by looking at the experiences of a person who had an accident. Emily tripped on the steps while leaving her house today to go to the gym. Her ankle is swollen and bruised, and she's in a lot of pain. She thinks she may have a fractured ankle. Emily's husband takes her to the emergency room at their local hospital, where a doctor evaluates her injury and orders an x-ray of her ankle, as well as prescribes pain medication. The radiologist determines that there is indeed a fracture. An orthopedist casts her foot and provides her with crutches. Through this experience, Emily has received both goods and services from the healthcare providers for her injury. The goods are the pain pills to assist with her recovery, the cast on her ankle, and the crutches to help her get around. The emergency room physician who evaluated her injury, the radiologist who x-rayed her ankle, and the orthopedist who put on her cast also provided professional services in the form of skills and expertise. Emily has insurance through her employer, but she still pays a portion of the cost for her emergency room visit. Patients like Emily, who experience major medical events and have insurance, pay a smaller amount called a copay or a deductible that helps defray a small part of the costs. The deductible is part of a larger sum that a patient's plan says the patient must pay each year before their insurance company will start paying its share. According to her plan, Emily also has to pay coinsurance, which is a percentage of cost that she's agreed to pay after her deductible is met. This cost sharing continues until Emily has met her out-of-pocket maximum, that is, the highest amount of medical expenses that she will have to pay each year before her insurer pays the rest. Thus, the largest share of the expenses for a major medical event will be paid by her insurance company. If Emily develops a secondary problem like an embolism and requires extended care, she may need to be hospitalized. Her insurance will be very important if she's hospitalized because insurance helps ensure that patients don't get overwhelmed with unexpected or extraordinary medical costs. Group health insurance works because members are generally healthy overall, but they want to protect themselves from any future major medical expenses by paying into insurance. Patients who aren't using the system are subsidizing those that need health care. In addition, when subscribers pool their money together, they also pool their risks together, and this is called risk sharing. In general, insurance works because the likelihood of a serious health problem, or the risk, tends to be low. Risk sharing is a fundamental way that people can get together to make sure that they are protected against significant medical events. By sharing the risk, everyone, subscribers, doctors, and hospitals, are protected from individually bearing the costs for those who need a lot of health care or who have medical emergencies. There are four main ways that Americans reported paying for their health care goods and services. Let's take a look at each of those. First, employment-based healthcare premiums. In addition to paying workers a salary, many employers also supplement insurance premiums for their workers. This benefits the company by keeping employees healthy, and it's a way to attract and retain workers. This was true for Emily, as she received health insurance as part of her employment. This arrangement is common. In 2019, 56% of private insurance plans were employment-based. Second, government-provided health care. This includes three sub-areas: Medicare, Medicaid, and the Veterans Administration, or VA. In 2019, Medicare funded about 18% of public health insurance plans, 17% was funded by Medicaid, and 1% by the VA. Emily's friend, Angela, receives health care through the government because Angela's dad serves in the military. Emily's mother, Daniela, receives health care through Medicare because she is over 65. Medicare and Medicaid directly pay healthcare providers for goods and services for certain groups of citizens, including seniors and those living in poverty. Number three, out-of-pocket. In 2019, about 10% of healthcare costs consisted of co-payments, deductibles, and other portions not paid by health insurance that individuals paid directly to their healthcare providers. As we saw in Emily's experience, there were portions of the goods and services that she was responsible for covering out of pocket. And number four, health policies purchase. In 2019, about 10% of private plans were premiums paid by individuals who had purchased health policies directly from insurance companies. So if Emily didn't have insurance, she would have had to pay all of the costs associated with her ankle injury on her own. This could easily have turned into a significant financial hardship for her, as often happens to those without insurance. Unfortunately, obtaining insurance can be challenging for some people, as they may not be able to afford it, are not employed, or don't qualify for Medicare or Medicaid. Thus, recognizing the complexities of how money flows in the healthcare system will help us as we take a deeper dive into healthcare delivery and payment reform in this course and beyond.